Welcome to MDIC's 5G Communication and Healthcare webinar. I'm Jennifer Waters, Project Manager for the 5G Work Group. I'm going to start by giving a little background on MDIC and 5G, and then I will hand it over to today's presenters, Omar and Inhel. MDIC is a public-private partnership created with the sole objective of advancing regulatory science of medical devices, which will benefit patients. Our members range from government to industry, and we also work with nonprofits. Our mission at MDIC is to leverage its unique position as the only public-private partnership of its kind to transform healthcare into human care. Collaborating with our partners to advance science, we enable medical technology to shape the world we want to live in and make that world possible by shortening the path from innovation to safety to access. Our vision at MDIC is a collective endeavor with a single shared vision, realizing the potential of transformative innovation so that everybody everywhere can thrive. 5G brings transformative advancements to healthcare, and medical devices are positioned to benefit from 5G's capabilities. Current deliverables that will be released soon are the landscape analysis document, as well as a one-pager that will outline security enhancement with 5G. Following this webinar, there will be a QR code on the screen and a link to the below to submit questions to the presenters. Without further ado, I would like to introduce our presenters, Omar and Inhel, who will take the lead for the 5G Communication in Healthcare webinar.
Thanks for joining us for this webinar about 5G in healthcare. Inhel and I are the co-chairs of the 5G-enabled medical device work group that is a part of the Medical Device Innovation Consortium, or MDIC. In this webinar, you'll be hearing from a group of distinguished speakers who will share with you several aspects of 5G use in healthcare applications. As a quick introduction about our working group, we note that 5G availability continues to grow as a form of connectivity for everyday communication needs, in addition to industry-specific applications. So we started to explore what 5G connectivity features can mean for medical devices and the healthcare community at large.
This prompted MDIC to form the 5G working group, whose purpose is really to involve key stakeholders and gather ideas that would facilitate the incorporation of 5G in existing healthcare technology, as well as facilitate the development of novel medical devices based on 5G, while ensuring patient safety, privacy, and device security. The working group deliverable included are in multiple forms, including white papers and as well as development of educational material, and this webinar is part of that effort.
The webinar will start with Marie Barani. Marie is a patient interested in connected medical technology, and she will introduce the 5G-enabled continuum of care. Then Clint Teddy from AT&T will share a brief technical background about 5G.
Jean Greathouse from the British Standard Institution will then present an overview of 5G in healthcare. We'll then hear from Dr. Patricia Geppert from the Joint Base San Antonio 5G Program Management Office. She will walk us through the 5G-enabled medical extended reality and robotics. Rama Pipaparji from L&T Technology Services will share his perspective on 5G-enabled mobile unit and remote care. With this, let's hand it over to Marie.
Hello, I'm Marie Barani. I'm a patient equipped with a medical device. I spend some time in hospital settings. With this presentation, I will bring you through the continuum of care as it is nowadays in most of the cases without 5G, and how it could be if 5G enabled. This presentation has been prepared with Scott Yoon from Johnson & Johnson. If we take the continuum of care as it is nowadays in the current state, if a patient feels bad, an ambulance arrives with emergency medical technician staff and equipment. The connectivity and communication with the hospital is quite limited because you can basically exchange text, data, audio records, but not so much more. There may be the risk that the network is congested, which means saturated by other communication that are not medically related. and solely the vital signs of the patient, in most of the cases, will be checked. So there is a limited triage. Once the patient arrives at the hospital, his condition has not been fully assessed. He's put in a queue depending on his priority and other patients' priority. He will probably stay at the hospital for an assessment and may have to come back later on to the hospital. And if outpatient care is deemed appropriate, the patient will return home. For inpatient care, the patient will need to come back or will stay at the hospital for treatment, but based on the specialist availability. For outpatient care, he will probably be given a prescription with instruction to perform. But once he goes back home for recovery, a recovery at home is quite limited. Telemedicine has only the capabilities to use existing data. You don't really acquire new data with existing telemedicine capabilities. And you will have, as a patient, to follow up with healthcare practitioner, mostly through scheduled visit in a healthcare setting or over the phone. Now, if we take back this continuum of care with 5G, what 5G can do is to improve it thanks to 4 main features. The first one is a higher data bandwidth, which means that you can exchange more data, heavier data records. The second one is mobile edge computing, so you can bring the data closer to the user, whether the patient or the healthcare practitioner. Then you have low latency, that enables you to treat those data and perform actions based on those data almost in real time with no delay. And the last one is that there should be a dedicated network slice for healthcare applications. So if we go back to our patient and the ambulance, once the ambulance arrives, there is a dedicated 5G network slice, which means that there will be no risk of congestion and the communication will from the ambulance to the hospital will go through. Patient monitoring and data acquisition is facilitated. You can acquire higher quality audio and video data that you can send back and forth to the hospital thanks to higher data bandwidth. You may be able to coordinate with a remote specialist, what require kind of a network being able to support a higher data bandwidth, but also that this coordination is done almost in real time. So you have a maximization of the utilization of skill set and resources and via efficient routing, because you can already plan what the patient has, which specialists are needed at the hospital and what type of resources before the patient arrive at the hospital. And you may also be able to, in fact, determine that there is no need for hospital care and you can release the patient after treating more than his vital signs. Once the patient arrives at the hospital, his condition is already understood thanks to the data you could acquire in the ambulance, and resources and equipment are ready. The patient condition can be monitored live and be available to remote specialists. So nowadays we have a medical device that can monitor the patient condition and acquire data at hospitals, but it's quite limited in terms of utilization because the specialist has to be close to the patient. And if the person is far away or not in the hospital setting, the monitoring of the patient is limited with those devices. A treatment plan will be prescribed for in or outpatient treatment. And after triage, some patient can be sent home for treatment at home with more capabilities than what can be done nowadays. For inpatient care, if patients stay at the hospital, treatment and procedure could be performed remotely through virtual presence and robotic surgery. It means that, for example, if you live in an unserved or very badly served area with not a lot of specialists and you have to send the patient to another hospital setting or very far away so that he can see a specialist that he needs. In fact, with 5G, you could have the specialist virtually present in the room and in the place where he is, because you need a lot of data to be able to do that. And you need the person to be able to communicate with the other persons in the hospital room, thanks to connected devices. That's extended reality, and that could be supported with 5G. So you would have someone remotely virtually present in the treatment room and participating with the person who are physically in the hospital. For robotic surgery, you could communicate with robots that will automate part of the process. That means that you can have a more efficient utilization of hospital resources and more capacity of care. For outpatient care, there will be more treatment and monitoring available at home thanks to the availability of 5G connected devices for the patient. And in the case of a disaster recovery, 5G enabled care at mobile units will be made available, which means on the one hand, you will have no network congestion because there will be dedicated network slice for healthcare applications. So in the case of a disaster, networks are often saturated, and here there will be the possibility to continue having medical communication going through with the 5G dedicated network slice. But you can also acquire, like in the ambulance, higher quality data, and so better understand the patient and treat him in the mobile units in a better and maybe more expanded way. For recovery at home, there should be available monitoring, diagnostic, and additional treatment capabilities through 5G enabled equipment and devices that the patient will have home, what will make remote care and also the virtual presence available at home for the patient. So instead of always going to the hospital or to the doctor, the patient may have devices that acquire data that would otherwise have to be acquired in a hospital setting through a specific check or follow-up. And 5G can also support extended or virtual reality, which means that you can communicate directly on time with your physicians as if he were in the room through extended reality and through the device you will have at home. You may have on-demand specialist support at home. So instead of having to go to the hospital, and you will have specific network slice to allow a higher level of capabilities for at-home care. So there is no risk of interference or congestion as it is in the current case with the network as it is set up. So 5G, in short, allows for acquiring better, more data, what makes that you can have already in advance. You don't need to make additional checks and go to the hospital setting. You can already understand what the patient have, and you can start treatment based on that. It allows also for a more personalized healthcare management for the patient. There are better utilization of resources thanks to the data you acquire, and there are less delays, which mean less cost and more time for the patient and for the healthcare practitioner. Thank you. Now I will pass off to Clint Chetty from AT&T, who will introduce you to the 5G technical background.
Thank you, Marie. As Marie mentioned, I'm Clint Chetty with AT&T, and I'm the Strategy and Innovation Director for our healthcare vertical practice. I'm going to give you some key technical aspects of 5G and explain how to divide up its characteristics for targeted focus and applications before handing off to Gene Greathouse of BSI. 5G is categorized in 3 ranges or bands of frequencies, with hertz being the measure referring to the number of waves per second. High band is typically between 24 and 40 gigahertz, with propagation distances, or the amount of distance that it travels from the radio, is measured in feet. Sub-6 bands comprise the mid and low bands of 5G, which are below 6 gigahertz, with propagation distances measured in miles. Mid-band is below 6 gigahertz to 2 gigahertz, and low is below 2 gigahertz, typically in the 850, 900, 700, and 750 types of ranges. The length of the waves of each frequency are measured in centimeters for sub-6 bands, and like the name, millimeters for high band millimeter wave. This matters because of the rule of thumb that a wave transmits through an obstacle of similar size to the length of the wave. 40 centimeters versus 10 millimeters has a rough reference between low and high band wavelengths. To give a common example, in music, you hear low bands, or what we call bass, very far off and through thick walls, even when we don't want to hear it. And higher frequency waves, or treble, the words in the music typically, you need to be nearby to hear that. And like with music, you can affect propagation or distance by turning up the power. Licensed spectrum allows for greater levels of frequency power transmission, while unlicensed has much lower limits. Deployment methods are dictated by these performance parameters as seen here. Towers typically will serve the sub-6 bands, those mid and low, but mid-band and high band can share what we refer to as micro transmission points, and typically they're deployed below commercial roof lines. In hospitals, as an example, millimeter wave is targeted typically in indoor areas where you have clinician lounges, surgical areas, imaging, ICU, and training areas where high bandwidth are consistently required. 5G introduced great performance improvements across not just speed, which we all read about, but latency, reliability, and scale as well. 5G has dedicated control plane features, which differentiates it from the previous G of 4G or LTE, where it shared a control plane between the uplink and downlink channels. For uplink or the upload channels in 5G, having a dedicated separate channel requires a standalone core. Most carriers are now either having finished deploying their standalone core to allow the upload of 5G, or they're going to be doing it probably by the end of 2022. Today, that's a 4G upload with a 5G download. And download links are what we all experience. So what does this control plane dedication allow? It allows for fast response times from transmission to receiver, which we refer to as latency, and provides for ultra reliability in the 5 nines range, that 99.999 range. There are additional features that help make up these new performance capabilities, such as ultra reliable low latency communications, which targets a transmission of a 32-byte packet at less than 1 millisecond of latency. This is performed with standards-based architectures that provide for the scheduling of overlapping transmissions. Now, there are a wide range of transmission options that all have differing performance and operational parameters. Use cases will drive the decisions on which to use. Now, understanding these spectrum profiles will help provide a great starting point for development, but improvements may change these profiles over time, making one better than another for a given use case. Staying current on operator and standards roadmaps will be crucial to development planning for devices. In the end, there is no single winner, but instead a toolbox of technologies to align applications to for a given environment and cost model. 5G may be the endpoint technology, or in some cases, it may simply be the backbone of a disparate set of connected technologies. But make no mistake, it has a key role in the accessibility of care for the future. Distributed and constant care environments will present a diverse set of parameters for these endpoints. Science is delivering more than better care, but also more options for connectivity to suit each situation. To discuss those ways for healthcare, let me introduce Jean Greathouse of BSI for an overview of 5G in healthcare.
Hello, everyone, and thank you, Clint, for the technical background review. I'm going to spend a little time on an overview of 5G in healthcare. As we prepare for the transition, 5G offers several benefits to drive the digital healthcare model. Through increased connectivity that enables a 24/7 healthcare without walls ecosystem that can meet patient and provider needs accurately, as well as improve the quality of life. So we're just going to spend a few minutes and take a look at the drivers, the ecosystem, as well as the bigger picture and how we can all help drive adoption. But first, let's start by asking the inevitable question. What are the unique drivers for 5G in healthcare? You'll see one of the key attributes is improving access and quality of care with the ability for much larger data and image files to be transferred. The lower latency and higher capacity throughput also offer enhanced capacity for telemedicine visits, as well as with video to remote offering video to remote areas while reviewing real-time data, which ultimately allows for earlier preventative care. 5G networks enable broader adoption of less invasive and innovative tools, such as AR and VR, as well as AI for preventative and predictive analytics in managing that patient care. We'll also hear more on the aspects of remote robotic surgery use cases ahead in another presentation. So while the patient remains at the center and obviously should remain at the center, the 5G ecosystem is a rapidly expanding industry of new entrants. Suppliers from multi-disparate forms and verticals in medical device, biotech, and pharma manufacturing, to network and equipment manufacturers, system integration, and as well as maintenance to test and then measurement and validation of those 5G networks. As you see in the diagram in the circle, the broadening to touch all aspects of the patient's journey is backed by the 5G offering. As wearable and connected devices increase in healthcare to facilitate remote care, the need for seamless connectivity and mobility encompasses new entrants into the healthcare ecosystem on a much larger scale than previously had. So with that broader landscape model, the care model is also evolving and bringing about additional challenges or what we call opportunities for the adoption of 5G. Thus, bringing together new parts of business, consortiums, and working groups to convene on global naming conventions, as well as best practices for evaluation methods. The expanded list of stakeholders is faced with building the needed infrastructure, security, and governance relative to complexity of healthcare and patient health information records, or often called PHI. Finally, there is the need to answer the obvious question: who pays for this? Who pays for what? When it comes to building this infrastructure in remote areas for rural access. So now that we've talked about some of the drivers, the ecosystem, and the bigger picture on how we can drive to adoption, so now I'd like to turn it over to Patricia Geppert, who will be covering use cases in robotics. Patricia, I'd like to turn it over to you.
Hi, I'm Patty Geppert, a program executive for the 5G and telemedicine program at Joint Base San Antonio 5G Program Management Office. I'm here to talk to you about 5G-enabled extended reality and robotics for healthcare. First, let's talk about why extended reality and robotics for healthcare in the first place. Both of these are emerging technologies that have the potential to enhance clinical practice and extend the reach of a clinician to remote or underserved areas. Extended reality creates this immersive virtual environment to collapse space and time and to bring people together. For example, it can bring distant clinicians together for training and mentorship, or it can bring clinicians and patients together to produce a remote therapeutic environment. Extended reality can also enhance the clinical experience. It can turn 2D medical images like MRIs and CT scans into 3D images that are more effective for telementoring, teletraining, or surgical planning. Or it can enhance the therapeutic environment to make it more effective. Extended reality is an emerging technology where virtual images are overlaid on real-world field of view. Extended reality is defined by a continuum with augmented reality on one end and virtual reality on the other. With augmented reality, you have a few virtual images that are overlaid on a mostly real-world view. As you add more and more virtual images to the real-world view, you have mixed reality until you get to the far end of the continuum where you have a fully virtual world. Where extended reality brings distant people together, medical robotics can actually extend the medical touch for remote surgery or even a remote exam. You can easily see why extended reality and robotics are important for telemedicine and remote healthcare. However, both of these technologies require a lot of data transmitted really fast. This is where the high bandwidth and low latency of 5G is essential. You just heard about some of the use cases for 5G, notably enhanced mobile broadband, or EMBB, and ultra-reliable low-latency applications, or URLLC. EMBB supports high bandwidth and low latency that is required for extended reality applications in medical training and therapeutics. URLLC has an even lower latency than enhanced mobile broadband, but just as importantly, it has a very high level of reliability. Extended reality for telementoring and medical robotics requires both the ultra low latency and ultra reliable communications, as well as very high bandwidth. So extended reality for telementoring and telerobotics sit at the intersection of EMBB and URLLC, requiring services from both. 5G will deliver effective medical care and training efficiently where it is needed. Now let's take a closer look at these use cases associated with extended reality and telerobotics for healthcare. The first one is medical training. Extended reality can recreate training environments that are currently limited to specific spaces like anatomy or cadaver labs. If you're in the medical field, you know that medical labs can be very expensive and resource intensive to run. With extended reality, students can turn any room into a remote immersive learning lab. So you don't have to be in a cadaver lab in order to have that type of learning experience. In addition, you can take those 3D augmented reality images and overlay them on mannequins to have a more realistic training environment with the benefit of haptic touch that mannequins provide. In addition, extended reality can be used to virtually transport a student out of the lab and into a real work environment for more realistic training. Because this is digital technology, you can collect competency data on each student automatically. When you're working in a lab, an instructor has to go around and physically observe each student at a specific task. It's difficult for a single instructor to be everywhere at one time. If you're using extended reality, student proficiency data can be collected automatically and give the instructor real-time information on how students are performing and how to intervene to make that learning experience more effective for the student. 5G-enabled extended reality provides more efficient and effective training on-site and remote. The next use case is extended reality for telementoring. Mentorship is helpful when you have healthcare providers that are performing specific procedures for which they need assistance from a medical professional with more experience in that procedure. Unfortunately, many times the mentor is not at that location. Extended reality can collapse time and space to bring that mentor to the shoulder of the mentee that requires it. This is especially important in underserved areas or rural or remote regions where they may not have access to specialty medical care. Instead of having to physically transport a patient to the medical specialist or the medical specialist to the patient, you can bring the remote mentor to the attending physician or mentee via extended reality technology. In fact, using extended reality, a mentor can actually interact with the mentee's field of view in order to point out specific aspects that the mentee needs to pay attention to, much like they would do if they were present in the room along with the mentee. Extended reality can also be an effective mode to provide expertise to first responders and mobile medical personnel who are in the field or in transport on the way to an emergency trauma center. In order for telementors to be effective, they need to have access to all the information the mentee has, a full situational and clinical awareness. 5G enables the transmission of digital medical records and imaging studies, as well as physiological sensor data and just general knowledge about the surrounding environment to give the mentor complete situational and clinical awareness for more effective procedure planning. 5G-enabled extended reality transport medical expertise to medical providers in need of mentorship anywhere at any time. Not only can we transport the presence of a medical provider via 5G-enabled extended reality, we can also extend the physician's touch to remote locations via telerobotics through the high bandwidth, low latency, and reliability of 5G. Robots controlled via very high definition real-time video, haptics, and access to critical patient information support remote robotics assisted surgery or remote robotics assisted exams. This technology is especially useful in situations where there are limited numbers of specialty providers, but their expertise is required broadly. 5G-enabled telerobotics can extend the physician's touch to remote locations. The last use case is extended reality for remote therapeutics, an immersive quality of extended reality medical therapy for on-site or at home. For example, virtual reality is being used in a mental health care setting to transport a patient to a safe, controlled, immersive environment for treatment. If a patient has a fear of heights, they can be transported to a virtual environment at the edge of a very tall building while in therapy. Or extended reality can be used to motivate patients in occupation or physical therapy by putting them into a virtual game that stimulates the therapeutic movements. Finally, extended reality can be used by a patient to give a remote virtual medical appointment, or an isolated patient can engage in a virtual visit with family and friends. 5G-enabled extended reality creates immersive on-site and remote therapeutic environments. In summary, 5G, low latency, and high bandwidth untethers extended reality and robotic technology, making it flexible and transportable. 5G-enabled extended reality technology creates immersive environments for training and therapeutics. 5G-enabled extended reality combined with high-definition video and audio and additional data gives a remote mentee a mentor-on-the-shoulder experience. 5G-enabled telerobotics combined with haptics extends and augments the clinician's expert touch. And finally, 5G extends medical expertise to remote, rural, and underserved areas. At this point, I will hand it over to Ramakrishna Pittapari, who will be covering the use cases, mobile units, and remote care.
Hello, everybody. Good afternoon, good morning, good evening, wherever you are. I'm Rama Pittapari, Vice President of Quality and Regulatory Services from L&T Technology Services for Medical Device and Life Sciences, helping our clients with a focus on digital health. Thank you, Patty, for a wonderful use case coverage as they extend to extended reality and robotics. Now, I will be covering the use cases of mobile units and remote care as they're used with the help of 5G-enabled devices. So I just want to set a context for 5G use case and mobile units and remote care. First, we want to focus on what does 5G offer as a performance specification that would be needed to facilitate these. One of them, most important, is the low latency, which is going to be near real-time information sharing. High throughput, that is another important aspect of sharing large images and other things. Improved security, significantly important in the healthcare space for privacy and security. And enhanced connection density, which is the number of devices connected per square area would be very high with the 5G. So mobile units are ambulances, converted vans and trucks, or even helicopters, and they're equipped with 5G-enabled devices for our context. And locations served would be urban and metro areas, intra and intercities, and rural areas. And remote care is really what's it about near, meaning within the same hospital. In the case of COVID, for example, people could go to hospital and nurses need not go to the patient along those lines. And far would be within the same area, urban area, where people can still be served with remotely. Very far is rural areas. Rural areas where people are living, the care can still be provided from the urban areas where the hospitals are. And telemedicine is even more broader in the sense of the preventive care and treatments, including chronic diseases, can be done for much larger distances. So mobile units, we'll zoom into it a little more. The purpose is really to serve underserved areas and communities with transportation challenges, either in the urban areas or in rural populations. So the populations that are serviced would be children, women, adults of all ages, and also migrant and seasoned agricultural workers and their families. So given this, we'd like to see what are the sample services that are provided by the mobile units. One of them is enrollment into health insurances and screenings for, again, wellness and illness to preventive care also. as well as chronic disease management, be it diabetes or any other chronic diseases. And dental care is also provided for people who can't go around to get the care. And eye surgeries in eye camps, for example, cataract surgeries are done through mobile units and camps in different places on the planet. And all of these can be helped by the 5G, including surgeries, which is different from the eye surgery, but any other general surgeries that could use mobile units to provide the surgeries. Low latency needs, again, we talked about that as one of the primary characteristics of 5G. So the situation that would need this is somebody got a stroke and they are in a mobile stroke unit and they're going to a hospital, and the prep can be done in the hospital by treating the patient in the mobile unit, for example. And a similar thing in the cardiothoracic unit, mobile unit, that will have equipment to help people in the mobile unit, but then preparing them to take to the hospital. And cases that needs near and real-time care, including intervention in real time. So we know about the golden hour where we talk about in a cardiac situation that people need care immediately. These are all the situations that would need the help of 5G in healthcare. So use case now is remote care, and we'd like to touch upon this in terms of what is the remote care. It'll enable significantly higher capacity in disaster situations, as we have seen in the case of COVID, avoid providing care for highly infectious environment. So people went to the hospital and they were sent home by monitoring them with wearable devices to measure their vitals and such, as an example. Even in urban areas, this was done. And also provide care for patients with the transportation challenges, either in urban areas or rural areas. So some sample services is remote patient monitoring in hospitals during COVID, as I mentioned, as well as annual physical visits are happening remotely now, significantly higher number of annual physical visits, where they go for a blood test and the doctor can monitor the blood results and then conduct the annual physical. Remote clinical trials for monitoring patient compliance. This is another area I worked on. And also the chronic disease management, whether it's diabetes or cardiac and other areas, we can definitely do that remotely with measuring vitals and sharing the data with the clinician. Preventive care, again, it could be for wellness and illness. Before you slip into illness, a lot of preventive care can be done. Preventive rehospitalizations with remote care monitoring, remote patient monitoring, heart failure and others. We have examples of these in the use case. And robotically assisted surgeries and large X-rays, CT, MR images that can be shared using 5G. So a consequence of all this would be in clinical trials in oncology, for example, the clinical trials participation itself could be more a treatment or a therapy after the patient has tried all other available cures and drugs and therapies, and they can participate in a clinical trial. And remote patient monitoring, either in the care situation or in a clinical trial, is really to monitor the patient compliance and then monitor the patient. So we just want to come to the examples of the benefits from all this. But the idea is also that all of what I've mentioned so far have been worked with digital health companies that have wearable devices, as well as remote patient monitoring applications. And we know the current limitations are with the 4G, but 5G will definitely enhance significantly the large population scalability. For example, providing healthcare for a very large population, preventing the hospitalizations, especially that's very important in the case of cardiac situations where people had some bypass surgeries and they'll go home and they can be monitored and prevent all rehospitalizations. Veterans and others living in rural areas, again, this is very significant for use of mobile units as well as the remote care. And cost effectivity. Cost effectivity is a very important aspect in this. Just put a perspective, the US healthcare spend has been $4.3 trillion. That is, if it's a GDP, it'll be the 4th largest GDP in the world, just to give a sense. And with 5G in healthcare, with all the benefits we mentioned, especially with mobile units and remote care, we can reduce the cost of healthcare significantly. And smart cities are going to be the future, and healthcare is going to be an important aspect of the 5Gs, providing the benefits of these as becoming a fully smart city, and making move towards value-based healthcare is another realizable goal for the healthcare industry, and improving equity in healthcare using 5G-enabled telemedicine globally. This is again, World Health Organization and other organizations are having this as a goal, and this will be achievable with 5G in healthcare. Okay. So we have seen all the benefits and the 5G in healthcare, what it is, what it entails, and all the various use cases. Now we'll let Dr. Omar and Inhale wrap up the webinar.
Thank you, Rama, and thanks to all the presenters for sharing about the different aspects of 5G use in healthcare, which helps highlight the opportunities for expanded patient access to healthcare services through expanded connectivity, allow innovative technologies like medical extended reality to be used at a large scale, and bring the continuum of care closer to reality with seamless connectivity between hospitals and homes.
We also learned about several challenges and open questions that should be addressed to help achieve these opportunities, like the need for coordination between multiple stakeholders to implement a realistic enabled application, and the lack of evaluation methods for evaluating those applications.
And this brings us to the end of the webinar. We hope that you found it informative.
Thank you all for attending the 5G Communication in Healthcare webinar. Please remember to scan the QR code with your mobile device or click the link below. Additionally, keep a lookout for the upcoming landscape report and security enhancements one-pager.